Know the difference: heart attack versus cardiac arrest. Cardiovascular disease is the #1 cause of death, and the number is expected to grow to 23.6 million by 2030. While in Singapore, a heart attack is the second cause of fatality. In this infographic video, we take a look at the difference between a cardiac arrest and a heart attack. What is a cardiac arrest?
Cardiac arrest occurs when the heart experiences malfunctioning and it stops beating unexpectedly. This is caused by an electrical malfunction in the heart that causes an irregular heartbeat, arrhythmia. In this situation, the pumping action is disrupted, the heart is unable to pump blood to the brain, lungs and other organs. The casualty may complain of electrical sensation at the chest area. When the heart goes into a malfunction, the casualty becomes unresponsive and stops breathing. In some cases, the casualty may show signs of gasping for air. The casualty may die within minutes if he does not receive treatment immediately. Immediately, call 995. And start CPR right away. Get help to find an AED and use it as soon as possible. Continue CPR until the ambulance arrives. What is a heart attack? A heart attack occurs when blood flow to the heart is blocked. In this situation, a blocked artery limits oxygen-rich blood from reaching a section of the heart. If the blocked artery is not opened quickly, the part of the heart will begin to die. In this situation, the casualty may experience breathlessness, chest pain that may spread to the neck, jaw, and arm, nausea and breaking into a cold sweat. The casualty may experience these symptoms slowly and persist for hours, days or some even weeks before a heart attack strikes. The longer the person seeks treatment, the higher the risk of death. Immediately, call 995. Every minute matters. Get medical help right away so treatment can be administered as soon as they arrive. It is not common that a heart attack leads to cardiac arrest. But when a cardiac arrest happens, a heart attack is a common cause.
Leading a healthy lifestyle both physically and mentally is key in having optimal health, reducing your risk of having a cardiovascular disease. You have a higher risk of getting cardiovascular disease if you are obese, smoking, have a poor diet, or if you have a family history of having cardiovascular disease. Reduce your risk of having a cardiovascular disease by maintaining a healthy diet, exercising to keep yourself active and get regular checkups. Like, share and follow us.